Hello, this is Eddie Garcia, Senior Vice President at Healthsperian, and this is For the Health of It. For the Health of It is a weekly podcast covering all things health policy, brought to you by Healthsperian, a nationally recognized health policy consulting firm focused on federal and state regulatory and legislative analysis, advocacy, and business strategy. Up first, your weekly Healthspiration, a moment to reflect on the bigger picture.
This is Tom Kasumpis, founder and president of Healthsperian. Long-term care in the United States is a significant social and economic problem. As our population ages and the need for long-term support services expands, there are significant gaps in financial support that are not met by Medicare or state programs. But the economic issues are secondary to the crisis that exists for families as they confront these issues with no financial safety net or organized system of support. As a nation, we've neglected to create an equitable model to support the frailest among us. The COVID-19 pandemic has defined the inequities that exist in our country in many ways. For our elderly population, it has demonstrated multiple flaws in institutional care and left elderly individuals in their homes in extreme states of isolation and insecurity. There is a dire need to begin to address these flaws in our long-term care system through a meaningful combination of public sector policy and private sector innovation. Families need support to understand long-term care needs, organize care plans long before a crisis occurs, and pay for required services. The conversations you will hear today put a spotlight on this crisis and offer meaningful insights from a group of exceptional subject matter experts. At Healthsperian, this is a topic that we live and breathe on a daily basis and are deeply passionate about. We hope that you will find this content interesting and thought-provoking, and we look forward to your input and additional thoughts on how we move forward in constructive ways to address this national crisis. Thank you.
Now join Healthsperian policy experts and friends for Stay in the Know, a weekly policy segment on the top health policy issues we're facing this week.
Hi, this is Tom Beauregard, Senior Advisor to Healthsperian, and this is Stay in the Know. Joining us this week, we have Risa Wilkerson. Risa is the Executive Director of Healthy Places by Design, a consulting group serving philanthropy, nonprofit, and community-based organizations across the United States. She provides overarching guidance and strategic vision to fulfill the organization's mission of advancing community-led action and proven place-based strategies to ensure health and well-being for all. Risa has nearly 20 years of proven leadership in the healthy communities field with a focus on equity, integrity, and collaboration. She has extensive experience coaching and providing technical assistance to multidisciplinary community-based partnerships across the country. Risa is an action-driven optimist, abundance thinker, and simplicity seeker. We also have Josh Hodges. Josh is the Chief Customer Officer at the National Coalition on Aging. In his role, Josh serves as consumer advocate for the coalition and works to align NCOA's programmatic portfolios and network activation strategy to enable NCOA to reach millions of individuals and empower them to enroll in benefit programs, prevent falls, and manage their health. Prior to joining NCOA, Josh served as the Acting Deputy Administrator for Integrated Programs at the U.S. Department of Health and Human Services Administration for Community Living. Risa, Josh, thanks for joining us today.
Thanks for having me on.
Thanks for having us.
So let's get started. What we're really trying to get to in this segment is, ultimately we want to discuss the kind of substantial and tragic effect COVID-19 has had on our aging population, and in particular on our seniors in residential facility care. I think at the highest level, we want to analyze the glaring sort of cultural and economic inequities that exist within our elderly populations that COVID has clearly exposed, and get into a discussion on the types of environmental changes and new engagement strategies that we believe can make a positive difference for our vulnerable elderly population. So maybe, Risa, I'll start with a question for you, just given your focus at Healthy Places by Design. How
Sure.
would we reimagine kind of the home in innovative care models for seniors against the kind of the backdrop of COVID?
So Healthy Places by Design really looks at the root causes of health as something beyond, of course, healthcare alone, and even beyond some of the traditional thinking of the strategies for healthcare, which would be around food and physical activity. Those are very important, but we really look at how communities are designed and neighborhoods are designed to enhance health from the more holistic level. So we now know that all the components of our lives, education, transportation, food, yes, activity, yes, also our social connections to each other, all matter to our health. And so when we think more broadly about sort of what the community design is, we believe that it's very important that the infrastructure around us really supports health in all ways. So as I think about aging, for example, I think about the ability for folks to age in place in a neighborhood where they raise their children, perhaps. If they wanted to stay there, that they would be able to move to a smaller home. Not all the homes are large or of a certain price or, a certain structure to where you would not be able to stay there. If a neighborhood had homes of varying sizes and types and structures, someone could just move down the street and stay with that same supportive infrastructure and community that they've had right along. And even if they choose to move, if the community is designed in a way that they have choices of places to be where they can stay active naturally, there are outdoor places to walk to and sit in nature and be active. There are lots of locations that they can get to in a way that is very accessible to them and affordable to them, meaning not just where we are physically active, but where we work, live, play, pray, any of those things. It's just really important that we have that kind of infrastructure that makes those things accessible. So I think really thinking about that lifelong journey is important when we think about the aging process and outcomes.
Yeah, it's interesting as I'm listening to you, the infrastructure is, I would imagine, much simpler to deal with. Those kinds of opportunities are easier to deal with in urban communities versus rural communities. Is that accurate?
Yes, in the sense of sometimes when we think about so many things being in close proximity, the rural settings, of course, have their advantages as well. Often there's much more sort of outdoor accessibility. And sometimes in smaller communities, smaller rural communities, there may be more opportunities to sort of socially connect, if you will. Lots of people know each other and stay in touch with each other. We have supported things like safe routes to school in the past, where we tried to help children be able to walk or bicycle to school. And of course, that looks very different in a rural area than it does in an urban area. But there are options. And really, when you bring people together to talk about the assets in their communities and how to leverage those assets and to come up with their own sort of creative solutions, when you involve the people who live there, we find that solutions are there no matter if it's rural or urban.
Got it. And either Josh or Risa, what is the role of the sort of the aggregator hubs in the social determinants of health space that are kind of emerging to support folks and families as they attempt to age in place?
It's a term that I'm not as familiar with in terms of aggregator hub, but when you described it, what comes to mind is the network of community health workers, for example. And I think there's a very strong opportunity when you look at something like that. Community health workers are people who are very familiar with, probably live in neighborhoods or have lived in neighborhoods. They have relationships established already in those neighborhoods, and they are very much in tune with the conditions there. And they are able to be a bridge between the folks that are, needing some services or needing some support, and the organizations who have those resources but maybe aren't reaching them well or aren't able to follow up well with them. And we've seen, significant improvements and positive outcomes when community health worker networks are employed to sort of, they sort of fill in the gap, if you will, in a lot of ways. And they really do help to connect people to needed resources and keep people connected and realize sometimes some of the root causes of the disconnects. So for example, if someone's not showing up to a medical appointment, a community health worker can help suss out that that's a transportation problem, not a unwillingness to take care of themselves or to show up, and then help them to find the transportation that they need. So if that's the line that you're thinking about in terms of hubs, I would love to see that grow, and not just as community health workers, but in other ways as well, because I feel like that's going to have rippling benefits.
And you are seeing models out there that are trying to get to kind of national scale. Go ahead, Josh. I'm sorry. Did you have?
I completely echo what Risa said. I think the reality is there is a real need for this on a national scale, but we've not seen a ton of scalable models of these things yet, at least in the broader aging space. But as society goes towards more supportive of older adults, and as older adults want to remain in the community, which they do, there's going to be an opportunity for a lot of these, as you would say, aggregators to grow. And I think there could be a real opportunity there, because so many of the reasons people have to move out of the community are for very specific things, transportation, food insecurity, exactly. Very specific things that are solvable in either the public or private markets for older adults. And so I think there is a real opportunity. I think the COVID crisis has exacerbated that, but this was coming for a number of years before that, as people have choose to remain at the community, remain, as Risa said, next to where they work, play, and pray. And I think this is an opportunity broadly for the market to be better supportive of older adults.
Exactly. So let me, and maybe just getting a little bit deeper, Josh, on that point around what COVID has sort of driven. So many people, they move into retirement, they don't understand long-term care needs, and they don't understand the related expenses. Most folks retire with an assumption that Medicare pays for most services, unless they've had an experience with a parent themselves. But then drives a lot of problems as individuals and families don't have the financial resources, and they also don't have a plan. And you just touched on that in your last answer. So when their function does start to decline and they need support, and we've all seen this, it drives families to despair, try to take care of their parents at home. It drives people into bankruptcy as they realize the expense associated with custodial care. Is your organization doing anything as a consumer advocate to try to support the need for a plan and before the crisis hits?
Oh, absolutely. So, I think the first point to really drive home is the scale of the problem. A number of individuals, as they enter retirement, just don't realize that from a financial perspective, there are two major risks. The first is long-term care cost, and the second is longevity. People often underestimate how long they're going to live, and thus have not enough money for retirement saved away. Work out of the UMass Boston, shows a 65-year-old male has a 50% chance of reaching 87, and a 65-year-old female has a 50% chance of reaching 89. So you're talking about 20 to 25 years of retirement savings that are going to have to be covered. And the other scale that's problematic is just the pure long-term care cost. If you're talking about nursing home coverage, it can easily go low six figures. It can easily go $140,000 out of pocket for those of you that pay for care. Median nursing home cost $92,000 per year. And so it's pretty sizable. So what in our mind, the COVID crisis really has uncovered to the broader society the problems of aging, but these are not new issues, especially when you find that the average older adult lives on 50% live on $30,000 or less per year, and 25% live on $15,000 or less per year. So there's a pretty substantial and growing concern when it comes to older adults' ability to afford the care that they need. From a consumer advocate perspective, National Council on Aging does work with many other organizations in the same vein to help really educate older adults on what the kind of the realities are, and almost more importantly, educate those who are in their 40s and 50s and 60s who are pre-retirement on the importance of planning ahead, the importance of long-term care insurance, the importance of of really working towards the goal and understanding that retirement can be a quarter of your life, and that you have to have the right amount of savings to go into the retirement and have the ability to retire how people want to retire. And I think that is something that we're going to, as a society, continue to strive for, but we're going to struggle for until we really understand the longevity and long-term care risk of our lives.
Yeah, and ultimately there needs to be, you mentioned long-term care cost. The long-term care, the sort of traditional long-term care insurance market is out of reach for most individuals. Just, it's medically underwritten. It's very, very expensive. But when you think about the majority of Americans heading into that last quarter of their lives, and some have enough to make it to the end from an income perspective, but they have a really meaningful blind spot when it comes to healthcare costs. And so there ultimately there needs to be some private sector innovation in this space that's different than traditional long-term care insurance policies. And there needs to be public funding, which is, I think, what you're alluding to. But underneath it all, there needs to be sort of education and a plan. And I love the fact that you're focused on folks in their 40s and 50s and 60s, because when people retire with this blind spot, without the right resources and without a plan, it's almost too late.
Yeah, there is both a prevention and a mitigation strategy. Prevention when it comes to education and making sure people are as educated as possible going into this phase and making decisions that really thinking through not just to retirement, but through retirement. And then mitigation for people who are in retirement, connecting them to federal benefits, connecting them to services that are out there to make the choice. And I think you alluded to it earlier, Tom. A lot of people for the very first time realize Medicare doesn't cover long-term care needs when they need long-term care needs covered by Medicare. And oftentimes people approach this in crisis. I have a very specific need. My spouse, my mother needs long-term care. Oh, she has Medicare. We're going to be in good shape. And then you get to the point where you realize that's not possible, and you're already up that creek.
Yeah, and it leads to all kinds of sort of, from a societal perspective, terrible outcomes because, again, it erodes families, but it also drives people to have to spend down and wind up, on Medicaid in subpar facilities.
Yeah, exactly right. And you're at the point where you don't have a choice, and you're on Medicaid spend down, or you're doing some number of other things, or you become you rely on a family member for informal caregiving, and that is a huge issue in our country. The unpaid caregiving crisis. 53 million people report being unpaid caregivers for adults or older adults. I mean, that is 20% of our workforce. Yeah. And so there are ramifications societally across the board, but it all comes down to each one of these is a personal issue and people struggling. And so from a society perspective, but also a personal perspective, there are a number of issues that we, as a society have to resolve.
Exactly. Hey, Risa, can I turn back to you? And it would be great. Can you give us an example of a community-based partnership that Healthy Places by Design is working today?
Sure. I mean, we're working in a number of partnerships across the U.S. Some at a level where we're bringing together community leaders for peer-to-peer learning and connecting to each other, and others where we're providing some direct service directly into communities. So, for example, right now we've got a partnership with the Danville Regional Foundation in Danville, Virginia, and have been working with them over a number of years to think about neighborhood quality of life. They did some work where there was a lot of input and leadership from within neighborhoods themselves for neighborhood residents to develop a quality of life plan. And this was, first of all, based on work they did to look at equity across their region, their footprint that they work, and to identify neighborhoods where there have been inequitable outcomes and to focus on them first so that those neighbors could really come together and have the agency that they should be having all along to determine their future.
And in an example like that, what kind of engagement do you get from the community in terms of, very specifically the quality of life plan? Do you get high engagement?
We have, yes. It's been incredible. And, part of that is because there's a high sensitivity to not coming in as outside experts and trying to lead a process as if we know that community's context. We provide more of a behind the curtain support structure, if you will. And we guide decisions that are made and help to think about where, how resources are being provided within the group so that there is leadership from the neighborhoods themselves and from that community. And, this was pre-COVID, but we saw neighborhood meetings with, full community rooms were full of folks that had come out to join together and to have that conversation together, do brainstorming and visioning together and prioritization. You come up with lots of ideas and then together they prioritize what they think makes the most sense to start on first. So yes, definitely a lot of engagement. And that would be true across the country. I mean, people want to have agency over their lives. And as I'm listening to this conversation about aging and retirement, and I really do think people want to talk about this, and just really there hasn't been as much encouragement societally to do so, or opportunities to come together in person and be vulnerable with each other.
Yeah, that's interesting. And how much of this do you think, what's the balance between educating individuals on the need for a plan and potential gaps, identifying resources for people that they might not realize exist within the neighborhood or within their community? And then the sort of the third is just economic barriers, to your points on inequities.
It's an interesting question. I think it's always probably more nuanced than we give it credit for. I think I heard someone say the other day that rather than ask sort of a how satisfied are you with question, they asked what's been your experience with the services we provide? And that really enabled the person, the recipient of the services, to say, well, let me tell you a story about what it's like to navigate your system and what is missing. And I think that's what we should start as a country. We should find out why there hasn't been more planning. What's been the experience that people have, and in what way would they like to receive more support for moving forward? How could that be made easier for them? I definitely think everything that I've ever come across, any kind of root cause that we ever talk about, has these layers. It's individual layer, who you're connected to and what kind of education you've received on a certain issue. But that's always tied into the systems that are out there and how they're structured and the biases that exist within those systems and, the navigability of them, as well as the sort of physical infrastructure that's, creates that whole setting to begin with. It's all tied together.
Yeah, I'm trying to think of the analogy. And people aren't necessarily good at planning for retirement income, but it's clear people, they understand the need for it. They don't necessarily aren't able to do it. But when it comes to long-term care, retirement, like retiree health, there really is there's all kinds of barriers. People don't understand what Medicare pays for, what it doesn't pay for, what the expected expenses are, the need for things like advanced care plans. There's just so many blind spots for folks, which is, I think it's terrific. Josh, your point on starting to educate people early in their 40s and 50s, because you do reach a point where once someone is in their 80s and they're starting to decline and they don't have a plan and they don't understand their resources and they don't have financing, it's an absolute tragedy.
So I think you're exactly right. I mean, I think the complexity of retirement is often underlooked. We often give an example of Medicare. When you're choosing your Medicare plan, for many individuals, this is the first time they've had so many options, and they could get to a phase of kind of analysis paralysis as they go through all of their options. Do we go Medicare Advantage? Do we go Original Medicare? If we're going to go Medicare Advantage, which of the many Medicare Advantage plans do I choose? And so I get that we train people very well about the importance of accumulating wealth and just talking about, continue to save money but when it comes to the decumulation phase and the living and retirement phase, I think that's an area that we as a society could really do a little better job on. It's just not a thing we're comfortable talking about. And I think Risa raised a really good point. I mean, I think getting down to the community level and listening to the individuals themselves is really kind of the key. It's not going to be top down that's going to drive this. It's going to be bottom up.
Yeah.
Well, and I would also add that, when we start listening, I think we're going to hear some things that have been coming out, especially now being highlighted with COVID, which is we have a system where we are not guaranteeing sick pay to folks. We have minimum wages that don't cover the cost of living. How do we ask people to save for retirement if the jobs that they're in are not structured in a way that enable them to save? Some people working 2 jobs or 3 jobs. There's no retirement benefit related to that job. Our whole retirement, saving system right now is often tied very much to certain kinds of employment, but not all. So
Right.
Again, if you kind of backtrack all of this, we're educating people to do something that we've not created a system that makes it possible for many to do.
Well, and I get back to you're exactly right. So much of it is, a lot of it's awareness, but it's more funding. It's the fact of the matter is, it's one of the reasons why we don't address this directly, is that there really is no public financing system for this. So it's the wealthy folks can buy their long-term care policies, but that represents a very small percentage of the population. So let's turn to the question of, as you talk about COVID, how do you see, whether it's, and this I think Risa maybe is directed to you, the sort of the changes that will occur in home care or facility-based care post-COVID?
Well, it's a very good question. I don't have a clinical background. I'm not an infectious disease specialist, so some of these things are at a technicality level that don't have the background for. That said, I because of where we work and sit, I believe the conversations around what kind of community we have are more important than ever. Are we structuring and looking to develop a compassionate, liberated community where folks have it is a human right to have education and healthcare for all? Those types of conversations. To your point about what gets publicly funded, for example, or how we structure something in a way where people aren't really having to struggle to obtain the kind of healthy foundation that they need from birth, cradle to grave, as they say. So, sorry, Tom, what was the question?
I was really trying to focus on sort of within the home, basically how care will change. And I'm not sure I have a solid answer for that at this point either, other than, I keep coming back to this theme. It's, as a society, it seems like we've somehow decided that we don't need to help people with their long-term care needs. And that's difficult to understand. And again, needs to be addressed through probably at some level through a combination of private sector models and public funding. And so the sort of home health needs are going to become so much more intense in this country, which gets to, Risa, your point on the folks that are delivering that care. It's just, there's going to be just anxiety about, even if someone can afford institutional care. So the pressure on the sort of the home care system is going to be really quite intense.
Yeah, what it makes me think of is how we've designed systems to push away the things we're uncomfortable with. I feel like we're uncomfortable with aging in our society. And so rather than figure out integrated structures that keep people close to family in their homes, and in the neighborhoods as long as possible, we've created these institutions where we pull everybody together in crowded spaces. And it's not a negative. I'm not saying that to be judgmental. I understand, the thinking around sometimes the added need for medical care and so on. We also know that, women are much more often the caregivers in families and much more often in caregiving roles. And these are areas where the pay is low. Often there's no benefits to them. So they're coming and going. I've had my own personal experience in our family with a family member who needed home health care, and the home health care workers, they rotated through them frequently because the pay was low. And when they could get a better paying job with benefits, they moved on, which made continuity of care difficult. It was a socially isolating in the sense that they would develop relationships and then that person would move on and they wouldn't see them again. And I feel as if, COVID's really helping us to think about what do we value in our society. We're seeing the parents that have trying to do homeschooling at home are seeing what teachers experience, and people, who are needing extra healthcare right now are better understanding the importance of nursing and caregiving. And I think we have the ability to be more creative. We can think more creatively about how to solve multiple problems or multiple issues with certain solutions. So if we thought about that community health worker, if we thought about how that network works, why couldn't we do something similar that really helped to create a network of folks who were paid well, and able to stay in that network, helping people stay at home longer. And perhaps that's there, and I'm unaware of the level of it, but I feel as if, we just, as a society, we just really need to, when I say it's a society, but just, as a country, really, as a group of connected people because of the place that we're living in, we really need to think about what's important and how do we help deal with the employment situation as well as the social isolation situation, health situation, with different types of solutions.
Yeah, it's interesting. I've seen data on the sort of the home health aid industry, and you see, and this gets to the points you were making, 70 to 80% turnover. It's an incredibly difficult job, low compensation, no benefits. And so I love the idea of sort of community networks with higher compensation, more security, lower turnover, and just, as you said, tighter connections to the community and the people that they serve.
Yeah, exactly.
Josh, any other points that you'd like to work in?
I mean, I think in addition, and I think Risa hit it, spot on. I mean, I think that one of the things that, we've been talking about is how COVID just uncovered a number of crises in this country, whether it's the home health care crisis, the caregiving crisis, the long-term care crisis, it just exacerbated it. I mean, social isolation was already an issue that we were working to solve for older adults. I mean, there's, studies out there that show social isolation has equivalent health risks to somebody as smoking, cigarettes every day, and an increased loneliness as you get older, and the increased financial health that we talked about earlier. And these have all been exacerbated. I mean, the solution to the COVID crisis is social isolation, is to be separate and apart. And so, we're talking about the narrative of, socially isolated isn't the answer. Physically isolated is being physically apart, but but socially connected, and helping people in, frankly, multi-generations be more connected. I think that as a society, as we start talking about how do we value older adults and how we value the aging experience, and I think Risa said it well earlier, is a multi-generational impact on just service to older adults. But going back to the unpaid caregiving crisis, you're talking 61% women are unpaid care, or of the caregivers in America, 61% are women, and 45% of the 50 million or so had at least one financial impact, and so these are real ramifications on our middle age or younger adults. And so long term, as we as society try to solve these issues, this is going to be something we need to continue to focus on, both for a paid healthcare model, but also a informal caregiver model, because these are the people that are doing the work, and we as a society have to solve that.
Absolutely. I have one other question. I think about the analogy of financial planning that people are more comfortable with, and again, even if they're we're not good at it. But the whole idea of sort of an assessment, and maybe this is part of what, Josh, you're doing in your attempts to educate, but if there was a way for individuals to periodically, whether it's once a year or every couple of years in retirement, sort of assess their needs, understand their resources, get educated on sort of community resources and potential sort of long-term care alternatives. Do you all think something like that would be viable, the idea of actually offering people sort of standardized assessment tools to sort of understand their position as they age in place?
So this is Josh. I absolutely think it could be viable. I mean, a very small sliver, if you look at the broad population, of access to, quality financial advisors to kind of help them through this planning. As you look at the more broad adult population, there's a huge opportunity and a huge need for what you're describing, Tom, is effectively, high quality financial advice and in a meaningful way. Within NCOA, we work to provide, that type of education, but it's also specialized information as well, specific to you as an individual. And there are other organizations out there as well, but I do think that this could be, part of the planning of aging and the planning of your financial portfolio is really understanding how you fit and where you are, and just continuing to educate on the longevity and long-term care risks that everybody has and how that can have a real negative financial outcome for adults.
Yeah, it's just an area where there are just so many blind spots for families.
I think that, it's a very useful concept for individual planning, and to make it more accessible, as you've said, Josh, that quality financial management is not accessible for a good number of folks. I would also say that it could help to increase some understanding about where we sort of all are where we are as a whole, the deficits that we have as a country in terms of long-term care needs and retirement needs. I would add, though, that it would need to be, I feel as if it would need to be designed with those who would most use it, and designed in a very compassionate way. There is still a worldview that's very much about, the bootstrap mentality. Each person has the ability to make it on their own if they can. And if they end up at the end of, 6 or 7 or 8 decades without a lot of money, well, you did something wrong, because, this is America and we can all make it if we want to. And I feel as if there's a really important framing that needs to happen, and an understanding, more opportunity to understand all of the lived experiences that are going on in the country right now, and how that notion is a flawed notion when you have systems that are set up to provide advantages to some and disadvantages to others.
I just wanted to echo what you said. I think that you're exactly right. It is not a one-size-fits-all, and it is not everybody can be financially viable or wealthy if they plan ahead. I think you're addressing, I think, the broader societal and public policy issues that we have as a country that we do have to solve, and that, again, COVID just exacerbated. Whether it comes to our education system, our cities, our investments. Bottom line is you're exactly right. This planning on an individual basis can only happen and only be meaningful if it's being done in a thoughtful and in a way that listens to the consumers themselves. But in addition, none of this can happen long term without broader public policy change, and we as a country accepting that that's something we need to do.
Completely agree. Risa and Josh, thanks so much for joining us. This has been a really terrific conversation. I appreciate your time.
Thank you.
Thank you.
Hi, this is Tom Beauregard. I'm a senior advisor to Healthsperian, the former chief innovation officer at United Health Group, and a founder of a new company in the elder care space called the Home Care Genie. We're focused on helping individuals age at home with an integrated set of personalized assessments, navigation services, and a unique insurance model that pays for the custodial care services that aren't covered by Medicare plans.
Here's our health policy breakdown.
Hello, my name is Melissa McHale. I'm a health policy analyst at Healthsperian. Today, I'm going to be having a discussion with Jean Dessau, senior partner at Healthsperian with more than 2 decades of experience in healthcare policy, data analysis, and strategy within both the private and public sector. Our conversation today is going to focus on Jean's most recent issue brief, which includes recommended innovations for reimagined multi-factor approach to care for seniors, with a focus on modernized infection control, use of technology, and development of home care models that address resources and operational constraints.
Thanks, Melissa. I really appreciate the opportunity to chat with you about these issues and the paper that we put together. Our team at Healthsperian has spent a lot of time during this COVID crisis focused on vulnerable populations who have been adversely affected by the disease. And we've spent a lot of time, because of our broader experience in the senior and aging sectors, in thinking about what kind of models are there out there, or what kinds of policy approaches should we be thinking about as we seek to really strengthen the protections for seniors. Inevitably, society's opening up. We're seeing greater economic activity. returns to school, returns to air travel and work. But that doesn't negate the importance of finding ways to protect senior populations during a pandemic. But it also raises bigger questions, which I think we're going to talk about today, about how do we, over the long run, for many things, improve the care and improve the opportunities for improving the health of seniors. So thank you. I'm interested in chatting today.
Definitely. And thanks for coming by today. Happy to have this conversation. To your point, I think we can start by saying COVID-19 has definitely really exposed a lot of gaps within the healthcare industry, as well as just some big problems and evolutions that we've been working on for years and years and years that honestly, COVID has been a catalyst for a lot of innovation as we're seeing these gaps in the system. And in your issue brief, you highlighted 10 innovations that you believe would be really important to improve the industry and to help protect seniors during the current public health emergency, as well as after the public health emergency. And, God forbid if we have any other future pandemics. So to just name a few, I'm not going to list them all, but I'm going to focus on certain innovations that you highlighted. Some examples of the innovations you provided included using predictive data to prepare for potential outbreaks, having long-term care facilities to work on preparing for that by using data, as well as working on developing and financing care systems to allow older individuals to stay at home longer and to make sure that they're still in connection with their care teams as they're in the home. So those are just some examples that I wanted to touch on today. And my question for you to start is whether you think there are certain public policy or operational solutions that we can use in the short term to encourage the industry to adopt these innovations, and then maybe some other policy or operational solutions in the longer term.
These are really great questions, Melissa. Because it is useful to think about these questions from both a short-term and a longer-term perspective. And I think that's what Congress was really doing when they enacted all of these shorter-term bills with funding for a range of activities to support providers and individuals during this crisis time. In particular, I would say improved telemedicine and hospital at home and care at home models are really going to be critical in both the short and the long term. Congress has certainly, through its regulatory approaches, loosened rules governing the use of telemedicine for Medicare populations and others, has changed how it will pay for services in the home, allowing different kinds of providers to go into the home, and supporting greater funding for personal protective equipment, for PPE. So I think in the short term, those are the kinds of things that can help, sort of bandage the problem or help in the short run. But I think the bigger questions relate to long run policy, one about how we are taking care of our seniors. Issues related to infection control have been around for a long time. Congress has been exercising its oversight for many, many years to try to make sure that seniors are protected from infectious disease, and in nursing facilities in particular. As we talked about in the issue brief, many of the greatest number of deaths have been happening for people in nursing homes because of COVID. And that's been really, really challenging. It's challenging for families. It's challenging for society. But it raises this broader picture of what are we thinking about when we think about senior care? Are we warehousing people? Are we not thinking about seniors from a public health perspective? What kinds of policies, big picture, do we need? And then what can we do to incentivize them? And often incentives are about money, and they're about relaxed regulatory frameworks, but they're also about process and innovation. So, for example, greater use of telemedicine could really help seniors stay in nursing homes, stay connected to their care teams, stay connected to their families. But one of the challenges is, what's the state of broadband in those facilities? How facile are senior people with using telemedicine or using Zoom? I mean, young people, oh yeah, I'll jump on Zoom, I'll jump on this, but I mean, it's a little more challenging for the 85-year-old in a nursing home. And so I think there could be sort of a reimagined approach about how we are wiring up our nursing homes for, wiring them for the future. And also how we're training families and their seniors that they're caring for in the use of these technologies.
Yeah, no, I think that's a really good point that you brought up about broadband, because that is definitely a pain point within rural regions or just where areas where Americans do not have proper access to high-speed internet connections. But I want to go back to your point about how necessity is the mother of invention, and I think we're seeing that now more than ever with COVID. And we're seeing CMS and HHS provide a lot of regulatory flexibilities to help providers be able to treat this pandemic without regulatory burdens. And I think one of the key things that we're seeing now is telemedicine and infection control have always been important things, but have more so kind of stayed in the abstract. And I think we're in a really important time in the industry where we have leverage to say, okay, we're seeing the pain points now. How can we use that to get more awareness that these things need to change? To your point about a lot of deaths being from nursing homes, I think that's very eye-opening for not only our society, but our government. And there is a new re-emphasized focus on yes, we need to protect seniors and we need to provide vehicles within the healthcare industry to make sure that we are protecting seniors. So to that point, I wanted to ask if some of the big regulatory flexibilities CMS has offered is related to telehealth and hospitals without walls, which allows hospitals to work in other settings outside of the physical hospital setting and to be reimbursed for that under Medicare for both telehealth and hospitals without walls. And I know one of the components within telehealth that stakeholders have championed for is to include audio-only telehealth within those flexibilities. Do you think that that is not necessarily a good solution to the problem, or do you see it as some way to kind of help with people who have issues with accessing broadband? But what would you say would be, I see audio-only telehealth as a good solution for the meantime, as we are shifting into a new regulatory landscape and a new industry landscape where we are implementing telehealth in our care delivery. Do you see audio-only telehealth as a viable solution, or what would be more adequate solutions to make sure that seniors have access to telemedicine?
You've really raised some very good questions. I think with regards to telemedicine, as with any new technology or innovation, it's not the innovation or the technology unto itself, it's how it's integrated into payment models and delivery models, and how those models reward positive outcomes generated by those models. So, for example, audio-only telehealth, really important now, I totally agree with you. It may continue to be for some populations with some conditions. It may be inadequate for others. And that's where finding it, I'm just using this as an example, but that's where you can integrate telemedicine into a payment model, and those who are invested or at stake for the risk-based outcomes for those individuals who are members of a health plan or people in a physician practice, to the extent that providers are at risk for positive outcomes, they'll figure out what the best way is to deliver care. And it might be an audio-only component, and it might be a more in-depth component. And also, there may be a real need for a continuation of in-person visits for certain kinds of care. So I think there's going to be a lot of experimentation going on, but I think that's where the caution remains that with any solution or with any reimbursement approach, there should be a continuous look at where outcomes are, but allowing flexibilities based on different kinds of populations to get to the best and most efficient way to improve people's health.
No, definitely. I agree. And I think that we're definitely going to see the industry rise to the occasion to integrate telemedicine into payment systems, which we're definitely already seeing right now. Members of Congress are even advocating for some permanency to include telemedicine within the Medicare payments system for reimbursement. And that's just, it's very funny to me because we've been talking about telehealth for a decade now. And we've seen more progress of that within the past 2-3 months than, 10 years. So it's very funny to see the industry really adapt and change when it very much just straight up needs to.
And you raised two other points that really strike me, and they're interrelated, and that's innovations for care in the home and then reimbursement to support that. So certainly the notion of how do we more effectively care for people at home was coming up way in advance of the COVID outbreak.
Yeah.
There's been a lot of interest in how do we help people to age in place more? How can we really evolve sort of care that can be provided in home settings as opposed to more cost-intensive facility settings where appropriate? Telemedicine is a part of that solution. So is the workforce, a protected workforce that's well-trained, well-educated, and can understand the needs, the public health needs of seniors. But to make that all happen, and there's a lot of experimentation going on right now, of course, in the Medicare program, but there's experimentation going on right now in what kinds of financing models can help support this area. The place where we find ourselves that's very challenging is that you have for sort of long-term residents of nursing facilities, Medicaid is the primary payer. You have Medicare paying for post-acute care traditionally, and now experimenting with allowing some in-home services that go beyond post-acute home health care. But still, for the large number of people that need these services at home, there really is no coherent funding approach that is linked to a broader model of care delivery, of helping people navigate the healthcare system, of linking them with social determinants of health services, but also there's no payment model that's really rational and integrated that can help figure out, well, what's the value of home modifications and for seniors, and what's the value of getting food delivery for a diabetic senior living at home? What can help a poor senior who's living at home? What about devices and durable medical equipment? How does that all get packaged up in a cost-efficient way that's accessible and can really help seniors stay at home? So there's a real need for innovations in payment and delivery finance. And I really credit CMMI for exploring movements that can bring more care and dollars to support it in the home. But there's a need, too, for a broader set of financing needs for home care workers, for personal care attendants, for social workers who can help come into the home, connect people to sort of services in the community that can help them stay in the home, and sort of package that all up in a model that makes sense. Part of the challenge there is how do you wrap into this payment model the cost savings from avoided or deferred use of expensive facilities?
Yeah, definitely. And I think we've seen, to your point, as you mentioned, CMMI had some certain demonstrations for our audience. CMMI is a branch of CMS, which usually works to find new payment systems and new models to deliver care. It's an experiment if the government waives certain regulatory frameworks to allow a new kind of payment model. How does that translate into outcomes? So within that, we've seen CMMI work on demonstrations about, okay, how can we facilitate care in the home? How can we keep immunocompromised people in the home as needed? And what do the outcomes as well as payment look like for that? We've seen some of those, which would be the independence at home model as well as the hospital at home model. We're seeing very big hospital systems. For example, Johns Hopkins uses the hospital at home model. So we're seeing certain hospitals and health systems use these models, but there are barriers to have home-based care be widely adopted for reimbursement, whether it's Medicare or other government programs or the commercial insurance market. But I think, like I said about telehealth, I think the regulatory space, the agencies, government actors are now really seeing why we need these things. To your point earlier, when they're like, why do we need home-based care? COVID has demonstrated we need home-based care. And especially as our senior population continues to age, there's just, now we are seeing very much an industry need to have not only care within the home, but also an adequate support system through staff, through, home care people, as well as medical professionals to facilitate this. And you touched on that in your issue brief, that we needed innovations within the workforce as well as within those payment models. I guess my question then would be, what do you think is a more critical innovation that we need to tackle first, or what would be a more feasible innovation to tackle first? A wider expansion of reimbursement for home-based care, or some incentives within the workforce?
You've really hit on some important factors. I would say that, one of the most critical gaps and needs in this area is for insurance models for home care.
Yeah.
So innovation in insurance models for home care that are meaningful and affordable alternatives to long-term care insurance, which has gotten very expensive, and models that will help people prepay for their home care needs, but also have them within an integrated kind of structure that allows for connectivity to services to help people stay at home and also help seniors navigate this super complex healthcare system.
Yeah.
So I feel there are a lot of opportunities for models where the traditional insurance models may not have worked so well for long-term care insurance, but maybe could be applied in the home care sector. And there is a lot of experimentation and thoughts in this area. Some public sector, like some states, are beginning to explore or experiment with giving sort of taxpayer-funded additional home care benefits on a per-day basis to individuals for home care. And, that's great, too. It's a source of financing. But if it's not connected to a more integrated system that also encourages the use and helps to make happen the use of credentialed, high-quality providers, that's really the secret sauce. Is how do you get enough funding into the system that can then appropriately reimburse a high-quality, flexible, nimble workforce? So It's all part of the same innovation landscape, and it's tricky because it's balancing a lot of different environments that haven't been balanced before. Community partnerships, like they talked about in our earlier discussion, community healthcare workers, rational, meaningful, affordable insurance frameworks to help pre-fund care, but also with a coaching or a navigation component that can help seniors really understand what it is the system can help them with and how to get from A to B.
Yeah, it's definitely a catch-22. You really need a robust workforce to encourage a payment system, but you also need a payment system to encourage a high-quality workforce.
Exactly.
How
do you break into that dialectic? I don't know.
But I do, from the way you just explained that, I do see very much a distinct role in which the government or these HHS has a role in providing models where reimbursement is available, whether it's through Medicare or other programs. But we're also seeing very much a market need to guide seniors through this landscape and to create incentives for a robust workforce to engage in what either be concurrently or forthcoming reimbursement models to encourage this care in the home. Can you just talk a little bit more about how the market can fill in that gap to guide seniors and the groundwork of these innovations?
Yeah, sure. I'd be happy to. I mean, I think, a lot of the questions come back to these deeper questions about about uncertainties related to retirement, what individuals and families are starting to think about as they're looking to their future, what adult children are feeling and seeing as they see their parents aging and becoming more frail and less able to care for themselves at home. So I think first there's a real sense of what are the needs out there and how big a deal is this for people. I mean, 20, 30 years ago, people weren't talking about it as much as they are now. In part, it's COVID, but also there's, people are living longer, and there's a real sense that the long-term care system has been underfunded for a very long time. And so I think you have to start with needs, and then you think about what are the resources there to support those needs. And you figure out what kind of gap needs to be filled and what people are willing to pay or able to pay to be able to ensure a meaningful, high quality experience aging at home. And also the analytics are really just beginning to develop around the return on investment of social determinants of health programs. So just how valuable is a grab bar in the home? It prevents falls. It can prevent nursing facility admissions. There are a lot of people looking at these questions about how sort of small investments today can really lead to better quality of life, better engagement with the community, reduction in social isolation down the road. So there's a lot of work to be done. You have people across the healthcare sector are thinking about these issues. That's why we talked a lot about predictive analytics. There's a lot of questions about, well, how can you predict who's likely to have a fall? How can you predict who's likely to get very sick with COVID? Science is showing us the way in a lot of these places, but there's also a lot of experience with falls and technologies and programs and supports to help people not fall. Predictive analytics can help us understand this better. And this ties into something that we've been talking a lot about Healthspirian as we talk about public health issues in the pandemic. There really needs to be a revolution in public health so that it's more focused on the needs of seniors, the risks seniors face every day, how that connects to social isolation and lack of supports in the community. Yeah. There needs to be a revolution in public health that is senior focused, that is geriatrics focused, and not a one-size-fits-all public health approach that maybe doesn't necessarily serve the whole population as well.
Yeah, definitely. I think there is a lot to be said about how critical social determinants of health can be for any individual's health outcomes. It's not, we are starting to see a shift now where we're evolving past looking purely on clinical measures and looking at what is this person's quality of life and how is that interfering with their health.
Right.
And I'm so glad that you brought up data analytics, because I just wanted to bring that up as well, that as you're saying, we have yet to see how significant those analytics can be in relation to social determinants of health, especially for aging populations that are vulnerable and can be dually, all right, I'm just using this population as an example, but like people who are dually on Medicare and Medicaid, which it's a particularly vulnerable population. Do you see, I guess I want to ask, like, how can the market use predictive data to help people? I'm imagining like kind of a pie in the sky ideal future where we are using data to help people do their care planning much sooner, to also tie into your other innovation, which is supporting the next generation of people as they work on care planning for their parents. But can we have an ideal future where we use data to kind of help with our care planning as we become seniors who are going to need care? Because I'm going to speak for myself. I'm a millennial, and we basically use data for everything. And we are seeing through wellness apps and kind of the Fitbit technology, we are seeing people use technology more comfortably and data more comfortably to assess their health and to be able to make the right moves, to be able to prepare for your health or to just take care of yourself on an ongoing basis. Do you see a future where the market could be creating these tools, these analytical tools or dashboards to help Americans in their 40s, 50s to kind of have the roadmap figured out?
Right. Well, no, and I love how you're talking about just the quantified self movement and it's not just restricted to millennials. I'm Gen X and I'm pretty quantified, but it's an excellent point. And I think particularly as we look to the future, and I think we need to when we're looking at seniors in long-term care, technology, data are all going to be tools that can help us solve this very difficult problem. One thing I mentioned in the paper, but don't go into as much detail on, is the evolution in robotics. Can help with infection control, can help with social isolation. Certainly that there's a lot of different technologies for infection, like UV lighting. I mean, scientists are working on some amazing science fiction kind of technologies that can have these applications in these settings. And so for analysts, for policy analysts and the policy community out there, we should all be thinking about, hey, wait, that's a really cool technology. This could help us solve a really persistent and challenging problem. I would say too that this expands not just to little technologies, but thinking about new and thinking about innovations in design, facility design. And this gets back to what I started with, how are we housing our seniors who really need to be in long-term care facilities? There are a lot of examples, and we mentioned a few in the paper, of sort of smaller models, scalable, sort of smaller communities that could either be places for people with Alzheimer's, villages for people with Alzheimer's to be living in, where they could be surrounded with data and analytics and care, appropriate, meaningful interventions that are well financed with high quality outcomes. So there's a lot of thought that, hey, the big nursing facility may be evolving into something very different down the road as we care for people who may need care along the continuum. Maybe there's a way that we can use analytics to help us figure out, are they at home? Are they, how to move them along the care continuum in a less confusing and more rational way, where the money follows people and you don't have to switch care systems or payment systems every time you make a move as a senior.
Yeah, definitely. I think interoperability of predictive data as it becomes more regularly used would definitely, interoperability is always a critical component when we talk about data within the healthcare industry. And just to clarify, interoperability just basically means that data is streamlined to be accessible throughout various data systems or industries. For example, an electronic health record that can be shared with multiple providers or with your health insurance plan. That's an ideal example of interoperability. So predictive data, as you said, is definitely going to be a critical component for long-term care facilities. And you said broadband was definitely one of those issues that's kind of a roadblock for certain seniors as well as long-term care facilities. I also know that the FCC is starting an initiative where they are giving providers some money or some technology. The FCC is trying to get broadband more accessible to specific providers and regions. Yeah. Do you think that's enough to kind of help providers as well as long-term care facilities get more incorporated?
I think it's certainly a great start, right? Let's get the resources. Let's work on that aspect of the broadband. But there's almost a bigger issue, which is we have so much technology innovation with communications and our devices, et cetera, et cetera. But all these great minds who are thinking about technology and what to do with the phones, the supercomputer phones we carry around with us all the time. I'd like to see some of that brought into the sort of traditional sort of long-term care environment. So who's, training the staff with how to, if you're in a nursing home, maybe there's the smart kid who's working in the, common room, hooking up the TV so people can watch stuff.
Yeah.
But is that sort of standard? What's the scalable tech that's really wiring up these older facilities for the future, and having the IT personnel available, either, what happens, I can't tell you the number of times that me or my friends with our aging parents have been called up. Hey, my computer's not working. Have you tried turning it on? But there's so many challenges with modern tech that how can we almost give access to that to make things simpler for seniors living at home, trying to access services in their community. Like, great if there's, it's a dance class for seniors. That's great. But on Zoom, but how do they work Zoom? Who's helping them? Who's there to help them do it if they don't have adult children? So I think there's I think there's a great opportunity, and maybe it's through volunteer programs or foundation funding, but to really up the game of technology by bringing it to seniors and not just to millennials and college kids.
Definitely. You're totally right. And I think that goes back to your innovations on making sure seniors have connected care teams. Just having not only a place, and technology would be a facilitator for that, but just having a space within the industry. And again, I think this is kind of a global thing of like this transition from the older ways of using things to integrating technology to replace some of these things. Would you say that the facilities then would kind of need to have sort of a data, I don't want to say team, but like a data within their facilities to not only show seniors how to use these different ways to connect, but also to help them figure out how to evolve in this new way?
Yeah. Certainly it might be an appealing factor for the facility of the future to have either as employees or under contract, like a consultant, like a firm that does this kind of stuff. You could see where that could be a plug and play kind of innovation that could be scalable around the country. So it's a great example of where there's opportunities to leverage technology. So broadband, of course, better broadband is an essential step.
Yeah.
But it's only so good as the people that are using it. And technology is getting so complicated. I can barely work my television, and I'm a regular consumer. So,
no, I have to agree. I'm definitely at a point where I'm like, why was this changed? I understood it before. Why did they change the software in my phone, But I think that might just go back to like a larger culture within the healthcare industry to say, hey, like, let's make this institutional knowledge of tech more widely available to create, more adequate care solutions.
Yeah, absolutely.
And that might not be something that we will see right away, but I definitely agree with you that we need to disseminate the institutional knowledge across senior generations. And I'm concerned that there may be a certain level of dismissal, but like, we don't need to teach the residents in our nursing home how to use this app because they don't care. And to be fair, there are going to be some people who are just not interested, but I don't think that that's the majority by any means.
No. And it's this is a great place for innovation in the sector as we're thinking about seniors and technology. And look, this can really be, I've been, and maybe this is what we close on, I've been the most moved by stories of people in really terrible health in nursing facilities, unable to see their family.
Yeah.
And I've been so moved by these stories because they're just so terrible and so painful for families. Now, I'd like to see a future where there's, both a tech ability to connect, but then also advances in infection control that can help, or processes and protocols where people could get in to see their aging parent who's dying and be in person. And you know what? In some cases, maybe take on the risk of catching a given disease. But that's really where we need some better protocols and better data and better consent so that people can figure out how they want to organize their lives in a really challenging situation and how they can be with their loved ones. And for individuals that don't have children or family to come visit them, how to make that end of life experience, how to make it more comfortable. The isolation that we've seen people have during this epidemic has just been terrible. Yeah. And I really, maybe I'll close on that because more than anything else, the stories of people not able to see their family member who is dying in a facility, those have really gotten to me. And I think there's got to be tech. There has to be tech and other solutions and care protocols and better PPE and robots. I don't know what it is, but somebody needs to be doing some thinking about that. And I know our team is spending a lot of time on it as we work with our clients, but I'll close on that. And I really thank you for your great questions today.
Yeah, thank you for being on the podcast, Jean. It was really great to talk to you. And I just want to close and say that I agree, compassionate care is important, even in the current landscape of social distancing. Just figuring out how to use tech to facilitate compassionate care will be an interesting journey to see in the industry. Thank you so much for being on the show today.
Yes, my pleasure. Thank you so much. Take care.
You too.
That concludes our episode for this week. Thank you for tuning in. If you have any questions on anything you heard on this week's episode, please head over to healthsperian.com for more information and deeper analysis. And as always, tune in next week for more health policy insights and discussion.